Hi, I'm Jerry Hesch, physical therapist that works at Hesch Institute in Aurora, Colorado. And I have multiple videos up on YouTube on cuboid syndrome. And this is certainly an interesting presentation. Highly rated lacrosse player. 2 years ago was rated #1 player in the nation. And is that correct?
Close.
Yeah,
18.
yeah,
Sorry?
yeah, but we don't like brag about that.
You don't like to brag. Okay, I'm sorry. I'm sorry. But he had a gradual onset of ankle pain, no specific injury, am I correct?
Yeah.
And this has greatly affected, this lateral ankle pain has greatly affected your ability to play. Seen multiple orthopedists, 18 months of physical therapy, sometimes 3 times a week, chiropractic care, PRP injection, surgery to remove a bone spur off the top of the foot. And if you can show the file there, we're almost 3 inches thick on that medical file, and on the left side you can see many x-rays, MRIs, dynamic MRI, etc. So what we want to focus now is looking at his feet, and when we compare superior glide of the fibula bone, I can see movement all the way in his thigh. So the movement translates through these joints, the superior and inferior joint between the tibia and the fibula. You can see easy movement there. Now if you come around to this side, you will see a difference. So not only in position, which I don't think the camera's going to capture that subtlety, but this lateral malleolus, part of the fibula, this lateral bump, is lower than the left. And when I come underneath it and I capture it and I try and induce superior movement, there's no give. Now there is good movement posteriorly through that bone, and if I lift it up towards the ceiling, there's that little bit of joint play, that little bit of mobility, that micro motion that all joints have. And now if we come and look at the midfoot, on the left, I can capture that midfoot and I can twist it, and there's easy motion here in the foot, and it translates all the way up the leg. On this one, which I've already tested, there's no give here, so we can't go past the midfoot and create movement into the leg unless we use an excessive amount of force. So he has lost pronation of the midfoot. He's lost the ability to flatten that arch. He's walking mostly on the outside of the foot. When I said that, you nodded yes. Yeah. You're aware of putting a lot of weight on the outside of your foot, and you're aware of having a difficulty of planting that foot so it spreads out.
Yeah.
Okay, very good. So then when we come and evaluate the cuboid, and I'm testing superior and inferior mobility, there is none. Okay? I cannot easily create superior and inferior mobility using a reasonable amount of force. Now if we come over and film the left side, so we stabilize, proximally with my left hand, I stabilize the lower leg and I capture that cuboid, and look at that play. Mm-hmm. So these are micro motions. And unfortunately, all the macro motion, the big motion he's been doing, has not been sufficient to restore the mobility in that right cuboid, right fibula, right midfoot. Okay? He's been working hard in therapy. He's a remarkable athlete, doesn't just do lacrosse, does all kinds of sports. Yeah. And so I tested his balance and strength, and they're fabulous. If we test forward drawer of the foot, it's very solid. So his anterior talofibular ligament, which is the most commonly sprained ligament. When you have an ankle sprain, you sprain that ligament. But that is solid. I can't create any drawer. Second ligament in line of most common sprain is the lateral ligament connecting the heel, the calcaneus, with the fibula. And that's really solid as well. So this is not a ligament injury. Okay, but I would submit that the pain is mediated by ligaments, because when his foot, with his body weight, how much do you weigh?
180.
180. So when you're walking on your right leg, you got 180 plus pounds going through that. Plus you have deceleration and, impact, whatever.
Yeah.
So that joint doesn't move, and so the joints around it have to move a little excessively, and it strains the ligaments somewhat. So I think the ligaments are the cause of your pain. And it's because we have lost motion. And so the key to treating this is to gain movement. I want to show the subtalar joint is the joint below the ankle. Okay, the ankle joint is called the talofibular, the talus and the fibula. Okay, but the bottom of the ankle is the heel, the calcaneus. Okay, and so the joint that I'm going to demonstrate right now is called the subtalar, below the talus, where the heel, the calcaneus, connects to the ankle bone, the talus. All right, so I'm capturing this left leg, and I capture the heel, and I twist it outward. See the foot move outward?
Yeah.
Okay, well, this movement happens in the joint below the ankle, but it also happens in the ankle joint. If I squeeze these two bones together down here, okay, then I'm isolating subtalar motion. Okay, but either way, we have motion here on the left. And if I push the heel outward, that's called eversion, we have good mobility. Okay? Now on the right side, when I try to push into eversion, do you see that tiny movement? I mean, it is just so slight.
Yeah.
It's much less than movement here. And if I try and twist the foot through the heel, the movement is so tiny, a lot of that motion is lost.
Yeah.
Okay? So we need to treat all of those joints. And you may see, there's a large number of videos on YouTube on cuboid syndrome. And there's not a whole lot in the literature. The first article on cuboid syndrome was by a podiatrist in Albuquerque in 1981, Parks. And there's only a handful of articles on cuboid syndrome. I think there's 6. And there aren't a lot of videos on it either. But the most popular treatment is to whip the cuboid up and out. In this example, your cuboid is already up and out. So the cuboid needs to come down and in. Okay? So there's only, you mentioned another therapist who also mentioned that sometimes the cuboid needs to come down and in. Most clinicians are aware of the treatment that's a cuboid whip, that whips it up and out. Now maybe it helps by gapping the joint, maybe. But I've treated folks who have had that several times, and it was short-term helpful, but only short-term. The key to understanding cuboid syndrome, when it doesn't respond to the cuboid whip, is that this is your cuboid bone on the lateral, and I'll give you a close-up in a while.
Oh.
Okay? But the heel bone, the calcaneus, connects to the back of the cuboid. So the heel, the subtalar joint, controls the cuboid a lot. The other bone that really controls the cuboid is the navicula, this one, that is part of the midfoot. Okay? And his midfoot motion is lost. His calcaneal motion is lost. So the other two bones that significantly influence cuboid mobility are stuck. So we need to unlock those bones to free up cuboid mobility.
Yeah.
And that's my big freak flag. That's the freak flag I raise, and you know, that's what it is. So this lateral foot pain really looks to fit that thing named cuboid syndrome, and obviously, given what he's been through for 18 months, obviously not many people understand cuboid syndrome.
Right.
What was your out-of-pocket for this diagnosis?
Oh, we've got tens of thousands of dollars.
Yeah,
Tens of thousands.
I'm sure we're up to close to 25.
Incredible.
In and out, and you know.
Yeah, that's
insurance
remarkable.
covers a lot of it. Some of it's not.
Oh yeah. Oh, so the real outcome,
No, this is what we.
you're out of pocket
Right.
Yeah, that's
You-
our out of pocket.
was
Yeah,
tens of
So
thousands.
it's even
Yeah.
more
Yeah.
with insurance.
Yeah.
Yeah.
Incredible.
thousands and thousands.
So we'll stop filming here, and I'm going to treat the right foot and ankle by restoring motion in all of those directions where it's lost. But I need to look at one more thing. I need to look at the top of the fibula in the back. Now, if I look at the fibula head in the front and I bounce it with my thumb, there's give. There's that little micro motion yielding, okay? So let's have you lie on your stomach with your feet off the bed. And so I like to lean into the feet and just kind of control it, control the legs. And if you want to come look, you can see this right fibula is posterior towards the ceiling if you compare it to the other side.
The right one.
Yeah, this one. Now it'd be easier if you look from my vantage.
Here and here?
Yeah, this is higher towards the ceiling.
Oh, yeah, yeah. I
If
can
you
see
look
that.
from behind me.
Right.
Okay.
I
Now,
can see it.
more important, and maybe it just developed bigger. So you have to test motion. You can't go by posture. You know, I can look at your car in the driveway and say, you have a low tire, but maybe the slope of the cement is wrong.
Yeah.
So you have to go test the tire. So we have to test the motion. I'm springing your left fibula, and you see that little bit of micro motion, that little bit of joint play, okay? And then I'm trying to do it on this side. There's no give. This is a big controller of movement down here in the ankle. So we will have to treat the superior fibula tibia joint, tib-fib joint. Okay, this is the other end of the ankle.
Sure.
Okay.
Yeah, that's all
Yes, it
the
goes from there to
Yeah.
there.
strain is going
Yes.
through there.
Yeah.
Then also I've had a hamstring thing
Have you?
there, so I don't know if that would correlate.
For 2 years,
Could.
in the midst of all this, he
Oh, is that
keeps
right?
Yeah, at
getting
the beginning
hamstring
of it.
pain.
Oh, interesting.
At the beginning.
Interesting.
Not knowing if it's
So
related.
I will look at your pelvis, I'll look at your hips, I'll look at your hamstrings. But for the purpose of this video, we'll focus only on the what I call cuboid syndrome.
Yeah.
Okay? Let's go film the skeleton that's hanging on that door. No, keep filming. So let me just show the relationship of the fibula and the tibia. So here's the right foot and ankle, and cuboid bone is right here, okay? And then the heel bone is this one there. I'm capturing that whole heel bone calcaneus, and again, cuboid is right here. And then this is the navicula, and this bone is the talus, okay? And here's tibia, the main bone, and then this one is the fibula. Thank you very much.